Hello, and welcome to Chapter 4. We are going to discuss today body systems and related conditions. I am your instructor, Lakeisha Jennings. At any time that you have questions in regards to the content that will be presented in this lecture, feel free to post your question on the live discussion stream. You can also email your instructor, or you can write down your questions and bring them to class. We just want you to know that we are always available to you. Okay, I'm going to begin by sharing my screen. All right, awesome. And let's begin. So, your book talks about bodies are organized, and you can follow me right on page 78, are organized into body systems. Each system has a condition under which it works. Homeostasis is the condition in which all of the body systems are working at its best. Metabolism is the physical or chemical process by which substances are broken down or transformed into energy or products to be used by the body. So, in this chapter, we are going to study all of the body systems. Each system in the body has its own unique structure and function. Structure and function is similar to anatomy and physiology. So, if you've ever had a course in anatomy and physiology, you know exactly what we're talking about. We are going to talk about the structure of each body system and its function. The body system can be organized in different ways. In this book, the human body will be divided into 10 body systems. So let's look at each one individually. As we are studying the body systems, keep in mind that in this chapter, we're going to talk about the normal changes of aging. So, the changes that the body will go through as we age, was considered normal and was considered abnormal. One thing we need to know: as we get older, our bodies will change. Some of those changes will begin to take effect at a very early age. Okay. But again, it's very important for you as a nursing assistant to be able to recognize what's normal and what is abnormal. So remember, let's go back to what we talked about in chapter 2. Chapter 2, we talked about the nursing assistant actually using their senses to be able to observe their resident or observe for any changes. Signs are what the nursing assistant actually sees, hears, smells, or feel. Symptoms are not directly seen by the nursing assistant, but are reported by the resident who experiences them. So, just a little brief study on anatomy. The anatomical terms as it relates to location of the body is seen here on the screen. And we'll talk a little bit more about this as we get into chapters. I think it's chapter 9 when we get into range of motion and things like that. So let's look at the first body system. This picture should look familiar to you. We talked about in chapter 2 burns and how each layer of the skin has burns, or it could be burn, first degree, second degree, third degree. So, what you are looking at here is the integumentary system. This is the largest system of the body. Why? Because this is your protective covering, your natural covering. So, what are some other points that we need to know about the integumentary system? Well, the largest organ is the skin. It prevents excessive loss of water and injury to internal organs. Is made of tissue and also glands. It is considered a sense organ. What does that mean? Your skin can feel things. It can have sensations. It can tolerate heat. Sometimes it can't. It may tolerate cold. Sometimes it can't. It also regulates your body temperature. Now, what happens as we get older? And this is when your actions are going to come into play. So, normal changes of aging to the integumentary system includes the following. The skin will become very thin and dry and more fragile. So, as I go through each one of these changes, I want you to now begin to think, what can I do as a nursing assistant to protect them or prevent these things from either happening or to keep it healthy? So, thin, dry, and fragile skin, less elastic of the skin, the fatty tissue can cause because it's getting thinner, it can cause the person to feel colder. The hair becomes very thin and turns gray, and it may at some point even begin to fall out. That person may develop wrinkles or brown spots. Well, this is considered normal age related changes. And the skin will become dry and itchy due to the lack of oil from the sebaceous glands. So, how can you help someone who are having these issues in the integumentary system? Here we go. You can assist with bathing only as needed. Use lotions as ordered to relieve that dry skin that we talked about. And so, what place will tell you if we can use that? If you said the care plan, you are correct. Be very gentle as the skin is so fragile. Remember in chapter 2, we talked about abrasions and skin tears. It can definitely happen when we're transferring our resident, even when we're providing care and rubbing the skin. We can't be too rough. Be gentle. Shampoo the hair less frequently because, again, the hair is very thin and so it may begin to fall out. Brush it very gently. You will notice that working with some of your residents who are elderly, even when you brush their hair, it comes right out. Assist resident to layer clothing or bed covers because, again, the sensitivity to the heat and cold. Make sure that when you are making your bed, and this is something that I will stress every time we make beds in class, is to keep those bed linens wrinkle free because laying on wrinkles will cause the skin to break down. And always encourage fluid intake if it's allowed, according to the care plan. Fluid intake will keep the skin extremely hydrated. What are some other ways that you can help with age related changes as it relates to the integumentary system? So, just a few things to think about. Now, what are some things that we need to report in this system? Okay. We talked about normal changes, we talked about what we can do. Now, let's talk about what's abnormal. This is what you need to know as well. If the skin is pale, white, or red, or has purple areas, we have to report that. Blisters or bruises. Bruises could indicate abuse. Bruises can indicate it could have been a fall. Bruises can indicate maybe another type of underlying disease. Complaints of tingling, warmth, or burning. Dry, flaky skin. Itching or scratching consistently. In chapter 2, we talked about a situation called scabies. Scabies causes severe itching. If the person or the resident has rashes or discoloration, if you notice any type of swelling, I'm going to give you a medical term for the word swelling. So, for the word swelling, let me go back here. I want you to remember this term, edema. I'm going to write this down for you. Edema. EDEMA. I'm sorry, my handwriting is not the best here. But edema. Edema simply means swelling. Okay. Cuts, boils, sores, or abrasions, or any type of fluid or blood that is draining from the skin. Let's talk about edema for a second. What causes edema? Edema is when you have swelling of the ankles. You probably see some of your residents who have like those swollen ankles. That is a collection of fluid that builds up in the tissues, and that's edema. It can come from eating excessive amounts of salt. It can also come from having some type of heart disease, which causes a person to swell. Okay. With edema, and I'm sure it comes up somewhere in this lecture. With edema, these residents will probably be on something called a diuretic or a water pill that helps get rid of the swelling. But one thing you can do is elevate the legs. That means take pillows and place them underneath the legs to float them. When you do that, that will cause the water to back up into the kidneys and to be released through elimination. So that's edema. Other things to report is broken skin, changes in the moistness, or maybe if it's really dry, if they have a wound that has changed its color, or if it has odor now, that's a sign that an infection is setting in. If you notice any changes in the scalp or hair changes, any broken skin between toes, or the skin appears different than normal, okay? If you notice these things, you definitely want to report this. Now, in chapter 6, we're going to discuss a little bit further on pressure ulcers, what they look like, and how we can prevent them from occurring. Okay. So I did mention scabies for a second, but here is a slide that talks about scabies. It is a skin infection caused by tiny mites. When I hear the word mites, I think about little bugs that live up under the skin. They lay eggs, they cause a rash, and they cause really, really intense itching. So if you notice a resident is scratching a lot, that is one thing that we do worry about. Scabies is very contagious and it is spread through direct contact. So these are residents that may be on contact precautions. They usually spread in crowded places such as long term care facilities or nursing homes and child care facilities. If a resident has scabies, we will treat them. We usually give them medications to help with the itching and to help kill those little mites that's up under the skin. That medication comes in the forms of lotions and or creams. Okay? So, that is your integumentary system. Again, at any point if you have questions, please feel free to reach out to me on your live stream. Let's begin to look at the second body system. The second body system is the muscular skeletal system. Okay, muscular skeletal system. When you hear the word muscular, you think of muscles. When you hear the word skeleton, you think of bones. And so you put that together, the structure and function. So the structure of this system is made up of muscles and bones. And now we're going to begin to talk about the function of it. So here are some points to remember about the musculoskeletal system. Your human body has about 206 bones. Bones meet at a joint, which causes movement. Muscles provide movement and it also produces body heat. Physical activity, exercise, all of that increases circulation, increases blood flow to the organs and tissues. So that's why it's very important to get moving. However, inactivity, which we'll talk about in a later chapter, can cause pneumonia, blood clots, and all of those things to set in. Muscles over time can develop something called atrophy or contractions if your resident does not move. Okay. What is atrophy? Atrophy simply means the wasting away, decreasing in size, and weakening of the muscles due to lack of use. A contracture is the permanent and often painful shortening of a muscle or a tendon, again, due to lack of activity. So you see, these two terms together can almost spell neglect if you do not get your resident up and moving. Take a look on page 81. You see a picture of a hand. Now, this picture is showing you what rheumatoid arthritis is all about. But if you look at the pinky, that is actually a contracture. And the way to prevent that is to keep your resident moving. Okay. How do we do that? We can do that by offering range of motion exercises that will help prevent atrophy and contractures. So, what are some normal changes of aging to the musculoskeletal system? Here we go. The muscles will become weaker as you get older. The body movement will become slower. You have more brittle bones. You have stiffer or painful joints? And did you know that you shrink as you get older? So, how can you help prevent situations from occurring in the musculoskeletal system? Always, always, always think prevention. Okay. You can definitely answer the call lights promptly. Remember, that will prevent falls. Keep pathways clear, clean up spills, place walkers, canes, and all of those devices that helps the resident to move around. Keep that within easy reach. Always encourage your residents to wear non-skid shoes that fit securely, fastened. Encourage regular movement and always, this is important, encourage self-care. You want your residents to be as self-managing as possible. Of course, you're there to help them, but we encourage self-care and assist with range of motion exercises as ordered. Okay. Now, what are some things that we have to report in the musculoskeletal system? If you notice that there has been a change in movement or activity, if you notice the resident is no longer able to do any range of motion exercises, which you will learn over in chapter 9, if you notice that there is pain during movement or the joints are swelling or increased swelling, if you notice warm areas over the joint or bruising or just aches and pains reported by the resident, we have to report these things right away. So, your book on page 81 talks about arthritis. Let me teach you a little bit about medical terminology. Let's learn some medical term here. So, the word arthritis, as a suffix at the end of that word, you see the word itis. Okay. Whenever you see the word itis, itis, that means inflammation. Okay. Something is inflamed. Okay. On fire. It hurts. It's swelling. That's an itis. Itis means inflammation. Now let's put the prefix in front of that word, itis, and or a root word. We're going to call it arthro. What does arthro means? It means a joint. So if you put arthritis together, it simply means inflammation or swelling of the joints, which can be very painful for your resident. Okay. So there are different types of arthritis out there. We usually say that arthritis is caused by an autoimmune illness. An autoimmune illness causes the body's own immune system to attack normal tissues within the body. So, the first type of arthritis we see is a rheumatoid arthritis. That's the picture that you see on page 81. This is a type of arthritis in which joints become inflamed, red, swollen, and very painful, resulting in restricted movement and possible deformities. And that's what you see in figure 4.3. Another type of arthritis that's pretty common is osteoarthritis. I'm on page 81. This type of arthritis affects the hips, knees, the fingers, the thumbs, and the spine. It is caused by degenerative joint disease, and it definitely affects the elderly. Now, here are some other facts that's important to know about arthritis. Arthritis is inflammation of the joints. I've already taught you that. It's going to cause stiffness and pain and decrease mobility. Arthritis may be caused by aging or injury as well. And we talked about the two types of arthritis. One thing that's important is pain and stiffness will increase if it's very cold outside or it's damp weather. We can treat arthritis. Even though we know it's very painful, there is medications and treatments for it. Sometimes we use heat applications. Again, follow your care plan. Exercises and diet changes can definitely help with arthritis. Now, let's talk about some other issues that may occur. We talked about brittleness of bones. Osteoporosis at the bottom of page 81 is a disease that causes bones to become porous and brittle, causing them to break easily. Okay. Why are we talking about this? Because menopause, Let's spend a moment on menopause. That is the end of menstruation for women. This occurs when women has not had a period or a menstrual period for 12 months. But when a woman is changing and her body is changing and entering into the phase of menopause, that's when we worry about osteoporosis because now bones become brittle. It is just something that happens as we age. So, what causes it again? Bones become brittle. It may be due to age, but lack of hormones. That's why we mention menopause, because menopause is lack of hormones. And that lack of hormones can definitely cause brittleness of bones. Even if you have lack of calcium, I know for me, I'm not a milk drinker. I try to get my calcium through yogurt, maybe orange juice. But if you are not a calcium, you're not taking in that calcium daily, this can definitely lead to osteoporosis and brittleness of bones. Remember, calcium makes your bones strong. Also, lack of exercise or heavy amounts of alcohol consumption can all cause osteoporosis. What are signs and symptoms of osteoporosis? So now we're looking at low back pain. These are people who may have a stooped posture, loss of height, or they are at increased risk for fractures, especially when they fall. So, how can you prevent osteoporosis from actually getting worse? Encourage residents to walk. Maybe do some light exercises. Move residents very carefully if they already have osteoporosis. These are your residents that every time you move them, you're going to hear a bone crack. Follow the care plan regarding supplements and different treatments like heating pads and things like that for your resident. Okay. All right. Let's look at some other items here. We're going to go ahead and let's turn to page 82 as we're moving along. Now, some of the residents you'll be taking care of, especially if you're working in a rehab unit. Okay. Remember, rehab unit can be right inside of the nursing home. You're going to be caring for residents who will have hip and knee fractures. A fracture, if you remember from chapter 2, is a broken bone. It is caused by an accident or it can be caused by osteoporosis. Preventing falls, which can lead to fractures, is very important. Fractures of the arm, wrist, elbow, the legs, and hips are the very most common. Signs and symptoms of a fracture is pain, swelling, or bruising, changes to the skin color, or limited movement. Weakened bones make hip fractures more common. A sudden fall can result in a fractured hip. That takes a long time to heal. Hip fractures can also occur when weakened bones fracture and then cause a fall. So, they are also at risk for secondary illnesses. So here we see that in order to treat these type of fractures, total hip replacement may happen. Total hip replacement is a surgical replacement of the head of the long bone of the leg or the femur. This surgery is often done for many reasons. Fracture hip from an injury or a fall that will not heal. Weakened hip due to aging, or hip is very painful and stiff. Now, your job is going to come into play after these residents have had the hip surgery. So let's look at what we need to do when taking care of someone who's had hip fractures and hip surgery. Let's look at hip replacement. So, here are some guidelines for hip replacement care. Okay. We don't rush the person, of course. We always follow the care plan. These residents are going to have limited movement. Okay. You cannot bend the hip or anything like that because you don't want to take it out of socket. If you take it out of socket, we have a whole nother problem. Okay. Now, here are some terms. I'm going to go back to these terms here because I want you to understand them. For example, partial weight bearing. What does that mean? So, usually people who have had hip and knee surgeries, and let me tell you, after these surgeries, it is extremely, extremely painful. So, hip and knee surgeries, you may have an order in your care plan that says partial weight bearing. A doctor's order stating that a person is able to support some body weight on one or both legs. You may see the abbreviation PWB. Another one is non weight bearing. That simply means the person is unable to touch the floor or support any body weight on one or both legs. Or you may have an order that says full weight bearing. What does that mean? A doctor's order will state that the person has the ability to support body weight 100%. So, see, when you're taking care of those who have hip and knee fractures, you got to make sure you pay attention to what's on the care plan because you don't want them to end up back in surgery. But I can tell you that hip and knee replacement surgery is extremely painful, even after in recovery, which means now they're in your nursing home. It is extremely, extremely painful. So, you may have some residents who may have to wear a cast, okay? A cast may be to mobilize a part or something like that due to a fracture. Cast must be completely dry before a person can bear weight on it, okay? So, for example, if the cast have just been placed, we got to make sure that it's dry. Elevate the extremity or the leg or arm that's in the cast if you have any type of swelling or edema. When a person has a cast, you want to make sure you're checking for swelling, for skin discoloration, bleeding, numbness, tingling, all of those things, because that's a sign maybe the cast is too tight. Protect the resident's skin from the edges of the cast and always keep the cast dry, especially when you are bathing or showering your resident. Do not insert anything in the cast. Sometimes it itches. So I've seen people stick pins and hangers and all type of stuff just to get to a scratch. Okay, we can't do that. And if there is any pain, gotta let the nurse know. Okay. All right. So we talked about hip fractures. We talked about hip replacement. Very, very painful. Now let's talk about knee replacement. Pretty much the same thing. Okay. Only a few other differences here. After the surgery, the person may experience um, a significant amount of edema or swelling. If that's the case, we may order special stockings. Okay, we call them Ted hose or elastic stockings. We'll talk a lot more about that when we get to chapter 6. Perform ankle pumps. That's just kind of like exercising the leg. Encourage fluids. Assist with deep breathing exercise. What does a knee and deep breathing have to do with anything? Well, when you practice deep breathing and coughing exercises after any major surgery, hip, knee, heart surgery, anything, your body is always at risk for developing blood clots or at risk for developing pneumonia. So, if that's the case, coughing and deep breathing will help get that mucus up so we don't have to worry about pneumonia setting in. Make sure you let your nurse know if there's any pain so we can get pain medicine if needed. And sometimes we may have heat as well as cold compresses to kind of help. Okay. All right. Okay. Sorry about that. I try not to have noises in my background. Okay. So, again, if you have any questions as it relates to the musculoskeletal system, please feel free to post your questions in our live stream. Now, let's look at the nervous system. We learned a lot about the nervous system in chapter 2. Now, let's put it all together. So, the nervous system is the control and message center of the body. That is the function. The structure or the makeup of the nervous system, you see it right here on the screen. It's made up of brain and spinal cord, and it's also made up of nerves. Your brain and spinal cord is your central nervous system, and your nerves is called your peripheral nervous system. So the nervous system itself breaks up into two other systems. Again, I don't expect you to know all of this, but to just be aware. of what this body system involves. So, what are some of those normal age related changes? Well, as we get older, responses and reflexes become extremely slow. You may also notice decrease in sensitivity to the nerve endings. So these are residents who may can't feel heat or cold, okay? You may have some memory loss more often with short-term memory. Or we always say if you don't use it, you definitely will lose it. So how can you help with someone who's having some changes in the nervous system? Number one, suggest that your residents make a list, write notes, and write things down. I actually have to do that. I have to remind myself each day things to do today. Okay. Place a calendar and cross out days as they go. That helps the residents stay current. Take an interest in the residents' past by asking questions or um, looking at pictures and allowing them to reminisce. What that does is kind of jog some of those memories back. That's mental exercises. Give them time to make decisions, okay? And avoid sudden changes in their schedule. That can cause a behavior. Allow time for movement and encourage reading, thinking, and other mental activities. Now, what are some things that we need to report as it relate to the nervous system? Any type of extreme fatigue or pain with moving, shaking or trembling. We kind of learn that in chapter 2. That can mean a seizure. That can be many things that can cause shaking and trembling. Hey, it can mean your blood sugar is low. Inability to move one side of the body. Who remembers what that means? The inability to move one side of the body. Well, if you remember what we talked about in chapter 2, if you said hemiplegia, you guessed it correctly. Okay. Hemiplegia is the inability to move one side of the body. Also, if they experience difficulty speaking or slurring of speech, that is a sign of, if you said a stroke or a CVA or a TIA, you guessed it correctly. That is the same with numbness or tingling. Any type of disturbances or change in vision or loss of balance must be reported. Difficulty swallowing, any type of mood change, memory loss or confusion, and I'm talking about things that is like new, violent behavior or unusual or unexplained change in behavior definitely has to be reported. Now, there are many other diseases and conditions that falls within the nervous system, one being Alzheimer's disease and dementia. But we're going to talk about that in chapter 5. So here are some terms that you pretty much already know because we discussed it in chapter 2. But here it is again. Hemiplegia is paralysis on one side of the body. We also talked about aphasia in chapter 2. Aphasia is the inability to communicate. Now, this, of course, is going to break it down to receptive aphasia, expressive aphasia, but I want you to understand simply that aphasia is difficulty communicating or speaking. Dysphagia is difficulty in swallowing. That occurs as well, and that is all part of the brain. Okay, remember, your brain controls everything. Okay, it is not only the control message center, it tells your organs what to do, it tells your limbs what to do. If a person has ever been declared brain dead, chances are they may not survive because there's no brain activity. Okay. So we talked about strokes. Here's just a quick review or some facts about a CVA. It occurs when blood supply to the part of the brain is blocked or lack of oxygen to tissue, swelling surrounding the brain. Weaknesses occurs on the opposite side. So what does that mean? If you look at the picture on page 85, the 85, the brain is divided into two parts. One thing that I like for you to understand about the brain, which is so amazing, is each section of the brain does something different. You got your occipital your occipital lobe in the back, you got your frontal lobe in the front, and you got your parietal lobes here on the side. So your frontal lobe controls your emotions. The side or parietal lobes here controls reasoning and thinking and communication. The occipital lobe controls your sight, and then your brain stem actually controls your respiratory rate, your heart rate, and those type of functions. So you see, the brain, the nervous system is extremely important. Okay. All right. So we already talked about stroke signs and symptoms. Remember, think fast, FAST. Now you're going to be caring for someone who's probably had a stroke. So remember, we talked about paralysis on one side of the body. That person is not going to be able to use one side of the body. They may not be able to talk. Okay. So assist with exercises. Always keep safety in mind when you're taking care of someone who's had a stroke. Make sure when you're referring to the side that is weak that you're going to say things like not bad and all those type of things, but use terms like the weaker or the involved side. Okay, help them feel a little bit of confidence there. Speech therapy may be involved, and that is with your speech therapist to help them start regaining the use of their tongue and forming words. Residents who have had stroke may have some type of confusion or memory loss, and always encourage independence and self-esteem. That boosts self-esteem, I should say. Pay attention to the skin because, again, if you have a resident who one side of the body is not functioning, that one side of the body can have some breakdown because it's not being moved. Okay. Make sure for your residents who have paralysis on one side of the body that you are doing activities and things to adapt to their disability of being paralyzed on one side. Later on, we're going to learn how to transfer them. So, using gait belts and things of that such. Um, Learning how to dress them. We talk about that in chapter 6. So, if you have someone who has a weaker side, we normally dress the weaker side first because we're going to support that side. Okay. All right. And then, how do I communicate with someone who has aphasia or who has the inability to speak? Make sure you keep your questions very direct and simple. Okay. These are the people where I need questions simply to be yes or no because their mind can't process all of that. And so it's going to be hard for them to really explain a whole lot. So you want to keep communication very simple. Give them time to respond and listen because a lot of times a lot of messages is displayed not only through verbal but your nonverbal communication. You may have to use pencil or paper to write things down. Always keep the call signal within reach on that strong side. Okay. And you may have to use picture boards or communication cards to assist them with understanding and also communicating. Okay. So, what are some of the things that we see in the nervous system? What are some of those other diseases or conditions, I should say? So, we talked about stroke. Let's talk about Parkinson's disease. Parkinson's disease is progressive and it's a degenerative disease. When I say progressive, once it happens, it keeps going. It doesn't revert itself back to being normal. Parkinson's disease causes stiff muscles, shuffling walk. Okay, that's what gait means, shuffling. Tremors. Okay, tremors are very difficult. These people tremor so much they can't even do their activities of daily living. Okay, that's how bad it is. And that's Parkinson's. So always remember Parkinson's as causing lots of tremors. So, how do I care for someone who possibly has this? Well, you want to protect them from falls, always prevent help with ADLs as needed, and those are your activities of daily living. You may have to assist with range of motion exercises. They may have swallowing problems because remember, if their hand is trembling, so is everything else. Okay, so be very patient with these type of residents. Another condition within the nervous system is multiple sclerosis. multiple sclerosis. That is a progressive disease affecting the central nervous system. Okay. It affects the brain, not the brain, but the spinal cord, and multiple sclerosis. Sclerosis meaning hard scars. What happens is on the spinal cord and part of the brain, there are multiple scars, and that's what causes multiple sclerosis. Again, it is a very progressive disease. It gets worse and worse and worse over time. So, residents will have so many different abilities and disabilities going on here. Symptoms may include, because remember, you got scars on the brain stem, you got scars on the spinal cord. These people may have blurred vision, very tired, tremors, poor balance, trouble walking, numbness, tingling. They have behavior changes a lot, and they may have incontinence. That is a word I'm going to circle for you because, again, it's a new word. But what is incontinence? It simply means the inability to control your urine or your bowels. Okay? Urinary incontinence, can't control your urine. Fecal incontinence, you can't control your bowels. These are your residents that's probably going to have adult briefs or adult diapers, which we'll talk about later. Okay? MS can definitely lead to blindness, contractures, and loss of function in the arms and legs. So they definitely can become paralyzed. Okay. And that's the picture that you see here on page 89. You see paraplegia, which means they're paralyzed from the waist down. You see quadriplegia, which means they're paralyzed from the neck down. So how do I care for someone who has multiple sclerosis? Again, be patient, assist with ADLs, give them time to communicate. There's your two famous words again: prevent and pause. Okay. Avoid stressful situations because that can trigger a flare up of multiple sclerosis. Also, avoid like extreme weather, really, really, really hot or really, really cold, because that as well can trigger some of those flare ups. Okay. All right. So we just talked about paraplegia and quadriplegia. Spinal cord or head injuries, page 89, also can lead to quadriplegia or paraplegia. What causes spinal cord and head injuries? Things like falls, sports injuries, diving, motorcycle accident, industrial accidents, criminal violence, all these type of things can cause head injuries. Um, Also, permanent damage, brain damage, can occur as well with your head and spinal cord injuries. These people have memory loss, loss of consciousness, paralyzed. Effects of spinal cord injury depend on the force of impact. So, depending on how hard they were hitting those areas, that's how severe it's going to be. Okay, so how their effects will be afterwards. It may cause paraplegia and quadriplegia, and these are people that's going to need rehab big time. And they're also going to need emotional support. Think about if you were told that you can no longer walk again. Okay. So, again, preventing falls. Now we got to prevent burns because these people cannot feel things. Pressure ulcers we'll talk about in chapter 8. But I'm sorry, chapter 6. But here's something that's important. We want to always encourage fluids and high fiber diet. Why? Because it prevents constipation. When you have a resident that is paraplegia or quadriplegia, whichever one, they are not having regular bowel movements. Okay. So we have to make sure that we provide fluids, high fiber diet, and things like that to help them keep the bowels flowing. Okay. Deep breathing exercises, remember, prevents pneumonia. Your book kind of talks about they may have something called involuntary erections of the penis area for males. There is absolutely nothing we can do about that. Okay. So, what else falls in the nervous system? Well, your sense organs. What are my sense organs, or the sensory system of what I like to call it? So, now we're going to talk about the eye. Okay. And the sense organ is for sight, and then the ear, the sense organ for hearing. Okay. All right. And we've already talked about visual impairment, hearing impairment, and things like that. Other sense organs can be your nose, your tongue, and we've already talked about the skin. Okay. I didn't mean to go back. I'm sorry. What happens as we get older to our in our sense organs? Well, we talked about vision and hearing loss already. Okay. And we're going to have a decreased sense of taste, touch, and smell. So let me tell you a little story. Once you get about 76 or so, what happens is your taste buds begin to leave. Okay. And so the best sense or taste that leaves first is your sweet and salty. And what is that taste bud that lasts the longest? Bitter and sour. And because of that, your resident is always going to grab sweets first. Okay. And that's because they lost that taste. So we've already talked about how we can handle hearing loss and vision loss. We talked about eyeglasses, we talked about hearing aids, we talked about communication boards and aids and things like that. Okay. So you should already have that in the back of your mind there. All right. What are some things that we need to report in this con- uh, system or sense organs? Changes in vision or hearing. Okay. Signs of infection, which you should know. We talked about that in chapter 2. So if you notice any type of drainage from the eye, redness, swelling, anything like that is a sign of possible pink eye. So you see how we merged that, we put that together? All right, dizziness or complaints of ear or eye pain. And we've already talked about vision impairment, okay? The wearing of glasses and contacts. And you got some people who go on to have the surgery to correct it. Cataracts will be corrected surgically, glaucoma. Medications will have to be given for that, okay? So the sense organs is all part of your nervous system. If you can think of any questions that you need to know, I've pretty much already went over it. We talked about stroke very heavy. We talked about seizures. And so those are some of the items that will appear on your test. At any point, you can go back to chapter 2 and you can listen to that lecture as well. All right, let's look at our next body system. We are just rocking and rolling here. Remember, we got to get through 10 and we're already on the fourth one. Okay. All right. This one is called the circulatory system. The circulatory system is made up of the heart, which you see here, and the blood vessels, which you see there. Okay? The heart and the blood vessels. Let's talk about what's the function of the circulatory system. I also call it the cardiovascular system. So, blood carries food, blood carries oxygen, and other essential substances to the cell. The beautiful thing about the heart is it's made up of 4 chambers. You have one here, which is the right atrium. This is your second chamber, which is the left atrium. You have your right ventricle, which is the third chamber, and your left ventricle, which is the fourth chamber. So it's made up of 4 chambers. The heart has a function, and it functions in 2 phases: the resting phase, which is diastole, or the contracting phase, which is systole. Once we start taking blood pressures, all this is going to begin to make sense. The major functions of the circulatory, remember, is circulating blood throughout the body. So the major functions of the circulatory system is to supply oxygen to the blood cells and to the brain, to supply antibodies throughout the body. It also removes waste products from the cell, and it also controls body temperature. If you are having poor circulation, if you've ever heard that term, that means the blood is not flowing in areas that it should. And those are people who may have very cold extremities, cold hands, cold feet. That is due to that lack or poor circulation. So, what are some normal changes in the circulatory system? Well, it's normal that our heart at some point will begin to function very slow. Okay. We may have decreased blood flow, and our blood vessels will become very narrow, which makes it very hard for blood to get through. So, how can you encourage or again prevent problems from occurring? Give them time for movement, always encourage them, Exercises are good. We can layer their clothing to help them stay warm because remember, not only do we have poor circulation, but we also have your residents who are on blood thinners. Blood thinners are medication that thins the blood. So when your blood is thin, you are even more colder. Okay. An example of blood thinner is an aspirin. Make sure residents have socks, slippers, and shoes on to help keep their feet warm. Okay. What are some things that we need to report and observe for in the cardiovascular system? Definitely changes in vital signs. And we're going to talk about that in chapter 7. Once you learn how to take vital signs, you'll understand the changes. Chest pain. We talked about that in chapter 2. What is chest pain? What could be going on with your resident who's having chest pain? If you guessed myocardial infarction or heart attack, you are correct. Okay? Severe headache, that's a sign that the blood pressure could be up. Okay, so let's talk about that. All right, we got a couple terms here, medical terms. Anything is hyper, if you remember what I told you, anything that's hyper is elevated. You got it. Anything that's hypo is low. Okay, so hypo, low. Remember that. So hypertension is high blood pressure. That is the medical term for high blood pressure. Okay, hypotension is the medical term for low blood pressure. So anybody's blood pressure that's 130/80, which you see here on the screen and above, is considered hypertension. Okay. You see the word diuretic, aka water pill. Okay, remember I talked about that when we mentioned edema, which is swelling. And it comes up here because many people who have hypertension will have swelling or edema as well. Okay, so here are some facts about hypertension that you need to know. Causes hardening and narrowing of the blood vessels. So over time, your blood vessels will become very hard and have plaque and stuff in them due to high blood pressure. Symptoms of high blood pressure can either be no symptoms at all, that's why we call it the silent killer, or it can be a headache, number one sign, blurred vision, dizziness. Sometimes there's no symptoms, like I said. Okay. The guidelines change every year. What does that mean? Some years they say 130/80 is considered high. Some say 130/80 is considered normal. It changes all the time. Okay. So, what are some of the things that we can do to care for someone who has high blood pressure? Well, you may be asked to take vital signs quite frequently. So, you got to make sure you recognize what's normal and what's abnormal. And a lot of you are probably thinking, oh, we can use a machine, we can just push a button. But guess what? Machines break down. So, we're going to teach you how to hear the blood pressure. Okay. And it's not hard at all. Offer frequent trips to the bathroom and offer call lights promptly. Why? Because I mentioned water pill. Anytime you give somebody a water pill, they're going to go to the bathroom. Okay. All right. And we've already talked about chest pain. That's what you see here. The term angina pectoris simply means chest pain. And we've already talked about what causes chest pain. Okay. All the time, it's not a heart attack that causes chest pain. Sometimes it can be that the arteries are so narrow that it has a hard time getting blood to flow through. And when you have blood pushing up against the arterial walls to get through, the symptoms you're going to have is chest pain. Okay. So when a person has chest pain, we do encourage them to rest. Okay. Again, we're going to call out because we don't know if it's just narrowing of the vessels or is it actually a heart attack. Okay. Make sure you tell the nurse there is a special medication that we give people for chest pain. It is called nitroglycerin, and it goes right up under the tongue. We've already talked about myocardial infarction / heart attack. It's caused by block of blood flow to heart muscle, which results in tissue death. The area of dead tissue may be large; it could be small. Okay. Serious heart damage can really occur from a heart attack. And we've already talked about signs, symptoms, and warning signs. Now, Because we've already talked about that, how do I care for somebody who's coming back to me who has had a heart attack? Okay. These people or residents may be part of something called a cardiac rehabilitation program. So they're looking at the diets that they eat, the type of exercises that they do to start strengthening that heart back up. Usually, people are going to be on a low fat, low salt, and a low cholesterol diet because those are the three things that caused them to have a heart attack in the first place. And help residents to learn how to cope with stress because stress equals stress on the heart, which can lead to another heart attack. And you don't want that. Okay. Now, there is a condition that comes from cardiovascular system that is imperative that you know. CHF, and I'll circle it for you here. CHF stands for congestive heart failure. Congestive heart failure. Gotta know it. What's going on with CHF? It means the heart has failed to pump efficiently because there is damage. Okay? Symptoms include I'm tired, can't breathe, I got a lot of fluid on me. These are the people who really have swollen ankles and swollen feet. We call that edema. You guessed it right. And they're also going to have um, difficulty in breathing. Now, with the edema, we've already talked about elevation of the legs, possibility that they may have a water pill. So you know what you got to put in place to prevent falls. Second thing is these residents may have to get their self weighed every single day, especially with CHF, because what happens is edema causes weight gain because that's fluid constantly building up. So we may have to weigh them every day. If the weight gets out of control within 24 hours, we may send them out for evaluation at the hospital because the diuretics or the water pills are not working. Other thing is medications will help. We just talked about that. Please encourage residents to follow their diet and to adhere to the restrictions, especially when it comes to salt. Give them time to rest. You may have to measure intake and output. That will be talked about in chapter 7. You're going to weigh them. They may wear special stockings. You may have to use extra pillows to help with breathing. Other conditions that comes from the cardiovascular system that I don't expect you to know, I do expect you to know CHF though, is peripheral vascular disease. Okay. That's fatty deposits in the blood vessels. That gets hard. So symptoms is cool arms and legs, swelling of the hands and feet. We've already talked about that. Most importantly, turning blue or the bluish color. Treatment includes just stop smoking, medications, exercise, surgery, etc. Okay. All right, I'm going to pause the video, take a very small break. You can do the same, but I think it's going to pop up a little quicker for you. And then I'll come back and we are then going to work on the respiratory system. Okay, here we go. So we last ended with peripheral vascular diseases, and I'm going to now fast forward because we're on the respiratory system is our next one here. All right, so you can follow along with me on page 94, part 5. All right, so respiration, the body is taking in oxygen and removing carbon dioxide, which is your expiration. Okay, so let me say that again. Inspiration, okay, is breathing air into the lungs, and expiration is exhaling air out of the lungs. Respiration is the process of breathing air into and out of the lungs. So let's see what goes on here. Here is the structure of the respiratory system. I don't expect you to know this, but the pharynx is the throat or back of the throat. The larynx is your voice box. Then you have your bronchi or bronchus, which is right here. You have your lungs, okay? And you have your trachea, which is your windpipe. And so air comes in and it goes right into the lungs. So as you inhale, and then when you exhale, it releases the waste or carbon dioxide. So we just talked about the structure and the function of the respiratory system. So what does it do? It brings oxygen into the body. When you inhale, when you exhale, it releases waste or carbon dioxide. Make sure you understand that. What happens as we get older? What are some of those normal age-related changes? Number one, loss of lung strength, okay? Decreased lung capacity, decrease oxygen to the blood, okay? Remember, so it's already, the blood is already not circulating well, so we're going to have decreased oxygen getting to the blood. And these people may also have weakened voices. So how do I care for someone, or how can I help someone who's having issues in the respiratory system? We can help residents avoid exposure to cigarette smoke or polluted air, because cigarette smoke can really trigger, okay? You could provide rest periods, encourage exercises that helps strengthen the lungs. Remember, we talked about those deep breathing exercises that helps if it's something that's ordered. And we can also position them for easy breathing. In chapter 6, we're going to learn a lot about how to position them in different positions. Okay, so we'll keep that in mind. All right, what are some things that I need to report in the respiratory system that we need to be on the lookout for? So changes in respiratory rate. Again, that is part of vital signs. So we're going to learn that soon. Shallow breathing, or breathing through, like, that's a sign that this person is struggling to breathe. If you notice excess coughing and wheezing, any type of congestion or discharge from the throat or the nostrils, sore throat, sore tonsils, every time they take a step, they can't breathe, pain in the chest, sputum is discolorated, all those type of things we need to report. Definitely, we're going to spend some time on vital signs, because vital signs will help you understand all of this, okay? So what are some of the chronic diseases that we deal with in the respiratory system? So the book talks about a disease called, and you need to know this one, COPD. COPD. It is called chronic obstructive pulmonary disease. This is a chronic disease. And remember, chronic means it's probably not going to reverse itself, okay? It's progressive. It's going to get worse and worse over time. This means the person will live with this for years. COPD causes trouble with breathing, especially in getting air out of the lungs, which is weird. There are 2 chronic lung diseases that are grouped under COPD. You have bronchitis, if you've ever heard of chronic bronchitis, and emphysema. Residents with COPD are at a high risk for contracting pneumonia. All body systems are affected when a person has COPD, because nothing is getting oxygen. Residents may be in constant fear because they can't breathe. Imagine if you always feel like you're suffocating. Residents have poor appetites, and they probably don't sleep well. Just overall poor health. So, what are the following symptoms of a person having COPD? First of all, does anybody know what causes COPD? You guessed it, smoking. Definitely smoking. And so with COPD, a person may have chronic wheezing, trouble breathing, shortness of breath, pale cyanosis, if you remember that, turning blue. Definitely confused. If you're not getting oxygen up to the brain, there is going to be some confusion, okay? And they're going to be afraid and anxious, all right? And so what happens, or how do you care for someone who has COPD? Well, first of all, you want to report and observe these symptoms if they're getting worse. Sometimes I offer them a pillow to kind of sit up so they can breathe easily. I give them small amounts of fluids and meals, because if you already can't breathe and you go stuffing yourself with a nice big meal, you're really going to have a hard time, okay? These are residents just like CHF. They're going to be on chronic oxygen therapy, or continuous oxygen therapy. Always do what you can to prevent infection, because if they already have issues with breathing, you don't want another infection on top of that. Okay. And encourage them to rest. They need to preserve and save as much energy as possible. If your residents have a fever or a temperature, got to report that. Okay. If you notice changes in breathing patterns, they're turning blue, all these different types of things, this has to be reported. All right. Let's look at our next section here, number 6. We're talking about the urinary system and its related conditions. So looking at the urinary system, what is this system made up of? If you said kidneys, you are right. That is what you see here, okay? You see kidneys, okay? You see a bladder. This is all the urinary system. So the structure of the urinary system, which you should understand, is the bladder, the kidneys, and the ureter and the meatus. What is the meatus? That's what urine flows out of. The bladder holds it and it flows through the meatus, okay? Down through the urethra and out through the meatus, okay? So that's the makeup, that's the structure, okay? Here are some important functions for the kidney. Real simple. It eliminates waste. Your kidneys produces urine. Urine is waste. And it also maintains water balance. How? Because if you're able to urinate, you are maintaining that balance. Okay? You're maintaining balance, fluid balance. So the kidneys and the urinary system is absolutely amazing. But what happens when we get older? The kidneys loses its ability to function as a filter. Okay? And so these are people that may have to be put on dialysis. Okay? The bladder muscles are very, very weakened. The bladder begins to hold less urine. And because of that, incontinence will set in. And we just talked about what incontinence means. The bladder may not empty completely, causing more susceptibility to infection. So how can you help? Encourage fluids, offer trips to the bathroom. Don't be frustrated or angry when they have signs of incontinence, which means you're going to constantly be changing their briefs. And always, always, always make sure residents stay clean and dry. Make sure they stay clean and dry. Your book also talks about urinary incontinence. It can occur in residents who are confined to the bed, who are paralyzed, who are elderly. But urinary incontinence is not just a problem with the elderly. I suffer from urinary incontinence from having multiple children, multiple childbirths. Sometimes your bladder muscles become weak and you have to do what you can to strengthen that. Okay. So if a person is having urinary incontinence, your book kind of breaks up into some guidelines here. Okay. Um, Offer bedpan, urinal. They may have to wear adult briefs, answer your call lights very quickly and promptly. Cleanliness and careful skincare is so important. And if they have an accident, we don't make them feel bad about it. We clean up that stuff as soon as possible so we can maintain that dignity. Okay. So what are some things that we need to report in this system? Definitely any type of weight loss or weight gain. Again, that's that fluid balance. Any type of painful urination, changes in urine. Now, we all know urine is yellow, okay? And it should be clear. But if you have urine that is really, really dark, concentrated yellow, have an odor or really cloudy, that is a sign that a urinary tract infection has set in. If they complain in the frequency or the amount of urination, if they have bladder pain, stomach pain, or back pain, or number one, confusion. Those are signs that something is going on with the urinary system. Now, urinary tract infection is what we have to look out for. Again, that can be also caused by someone who is bedbound, okay? And also if you're not doing proper perineal care, or pericare for short. What is that? That is cleansing of the genitalia and the rectum for your resident, okay? Always encourage. Now, the symptoms I just went through, those are signs of urinary tract infection. So you always want to encourage your residents to wipe front to back. Okay. And if it's a male, wipe away from the tip or the hole, because you don't want to introduce microorganisms into the hole, because it's going to creep up the body. Okay. Into the body or into the bloodstream. Give careful perineal care and make sure you change those incontinent briefs. Briefs should be changed at least every 2 hours. Or just think about how often you think your resident goes to the bathroom. Okay, before and after meals, when waking up, before going to bed, those type of things. Okay, kind of like a schedule. Answer call lights, we talked about that. Make sure they take showers. Sometimes showers are better than baths. And report if the resident has a fever or they have any type of behavior changes. All right, let's jump right into the digestive or gastrointestinal system, my favorite system here. Let me pause you for 1 second. Oh, okay, it won't do it. All right, so let's talk about the gastrointestinal system. Let me go here. This is a picture of it. Again, I don't expect you to know this entire structure, okay? It's a lot to learn, but just understand the basics of it. So here's the structure of the gastrointestinal system, okay? With the gastrointestinal system, I want you to understand the process, okay? So here is the process. We eat food, it gets absorbed, okay? That's the start of the digestion process. After it's absorbed, it is transferred into the intestines and the stomach, where the nutrients and everything will come out. After all the nutrients are out of the food, last thing is elimination. So you eat it, digest it, the nutrients come out, and elimination will expel the waste. What type of waste am I talking about? Having a bowel movement. Very good. All right. Make sure you understand just that process. And it is listed right here on page 98. You can highlight that in your books. All right. What are some normal changes of aging as it relates to I'm going to call it GI system for short? Your residents will have decreased saliva production. So dry mouth will set in. And because of that, you got to be careful with chewing and swallowing, because they may have some difficulty with dry mouth. We talked about losing their sense of taste. It may take longer for them to digest. And so because of that, constipation may set in. And so when constipation set in, you got to think about those things that we can do to kind of help prevent. Remember, that's your role, prevent. So things like fiber in the diet, apple juice, prune juice, getting them up and moving, sitting them on the toilet to help facilitate movement of the bowels. Those are things that can help prevent constipation. Okay. You can also help by providing regular mouth care. We're going to talk about that in chapter 6. Make sure dentures fit properly. If they don't, let your nurse know. Okay. And make sure that residents are eating their food. A lot of times we don't pay attention to that. We assume that they can feed themselves and they may can't. Okay. So again, got to be careful with that. So, what are some things that we want to report in the gastrointestinal system? Number one, if they have difficulty swallowing or chewing, if they have, here's another term, fecal incontinence. Fecal incontinence. What is fecal incontinence? Now, that is incontinence of the bowel. We talked about urinary incontinence. Now we have fecal incontinence. Okay. Any type of weight loss, abdominal pain, diarrhea. Remember, we talked about C. diff in chapter 2. So we want to make sure that's not what that is. Okay. Constipation report. Flatulence is just another term for gas. Some people do have a lot of gas. If you notice that when the person is having a bowel movement and it's black and hard and bloody, hey, we got to report that one right away. But most importantly, you want to make sure you report poor nutritional intake. Okay. Poor nutritional intake. All right, so we talked about constipation and we talked about ways to eliminate constipation. That enema, which you saw there, is just introducing water into the rectal area to kind of help eliminate the stool. In order to do that, though, that takes special training, and every facility doesn't allow for that. Fecal impaction is also an emergency, could be. That's when you have very hard stool that is stuck in the rectum and it cannot be expelled. Okay. And that's just a result of constipation that hasn't been treated. And so, because of that, we notice that there's no stool for several days, but also we have oozing of liquid stool. That's a problem with pain. So, the treatment is the nurse or the doctor may have to take one or two glove fingers, insert it into the rectum, and we may have to dig that out of there. Okay. So, that's a problem. How do we prevent that? Make sure they're eating fiber in their diet and they're getting plenty of fluids. That's the part that you can at least do, making sure that they get plenty of fluids. Other issues we have in the system are hemorrhoids. Hemorrhoids are veins that is outside the rectum. They enlarge due to straining and constipation and things like that. Symptoms are burning, pain, bleeding, and even rectal itching. There is medications for that. Even soaking in a warm bath can also help with that. But if you have a resident who has hemorrhoids, you got to be careful with wiping. Okay. And then diarrhea, we talked about that in chapter 2. But what is diarrhea? Diarrhea is the elimination of liquid or semi liquid feces. That usually happens because of an infection or some type of bacteria has gotten into your food and water, causing the diarrhea. Symptoms can be abdominal cramps, nausea. Some people vomit with diarrhea, depending on if it's a food poisoning, if it's a flu, or something like that. We can actually treat diarrhea with medication, okay, to kind of help harden up those stools, okay? Then you may have something called gastroesophageal reflux disease or reflux. That's when food or stomach contents come back up into the throat. If you have a resident who has a history of this, you'll notice that if you lie them down too quickly after they eat, it'll come back up. Okay. If you notice that these are people that or residents that you have to, after you feed them and after they eat, they have to sit up for at least 30 minutes to an hour. Okay. I actually give them longer than that, maybe 2 to 3 hours to kind of help that food digest. But there's also triggers. Things like spicy foods, eating large amounts of foods can definitely trigger that. All right. Other issues that we'll see in this system, and you can follow me on page one. I don't like looking at my fingers anymore. Page 100. It's ostomies. On page 100 at the bottom. What is an ostomy? An ostomy is a surgical creation of an opening from an area inside of the body. When we do an ostomy, which is a surgical procedure, you can create either a colostomy or an ileostomy. What makes the difference? The colostomy is probably more of thicker stool, ileostomy is looser. Why do people have to have this? Well, it can be due to some type of bowel disease, cancer, or trauma, which means part of the intestines will have to be removed. And because of that, they no longer can have bowel movements through their rectum. And so now they have to have a bag placed on top of something called a stoma. And I can show you what it looks like. This is the stoma area here. Okay, so that's basically the intestines outside of the body. And we have to cover that with a bag. And that's what you see on page 100. And so, what is your job? Your job is probably to clean that area and probably to empty the bag. Okay. It's very rare you may run into patients with colostomy, but here and there we may get a couple in a nursing home, maybe one or two. And if we do, especially on clinical site, I'll take you over there to kind of show you how that works. Okay. All right. Let me go back here. I'm sorry.